And welcome back. Well, the emergency room can be a daunting place, not only because you're sick, because also you know that an expensive bill is sure to follow.
Yeah, here now with an alternative to the ER is Dr. Denise Abernethy and Dr. Eric Adar. They are with Popcare, an immediate care clinic designed to treat patients with acute and minor medical conditions quickly, conveniently, and at a reduced cost.
Nice.
Great to see you guys.
Thanks
this
for
is
being
a
here.
fantastic concept.
Thank you so much.
A lot of people have been to the ER when a clinic like this would probably be much more accessible, convenient, and less costly. Talk about the inspiration for Popcare.
We have started as a group of emergency physicians who practice in very busy ERs around the city. And we're concerned about the plight of those patients who are not as ill, who understandably need to wait a little bit longer to wait for care. And they understand that, and they're patient. But they have busy lives, they have children, they need to address other issues. And we wanted to create a place where they can be seen quickly, efficiently, at a reduced cost, and have that integrate as part of their day. Popcare is situated in an area with other major retailers, so we are there to provide retail medicine to be convenient.
Mm-hmm. Wonderful.
How did you come up with the name? What does it mean, Popcare?
Yes, we get that question a lot. Popcare means caring for the population.
Okay.
So we take care of patients from infants to seniors, all ages. We wanted a name that was representative of our philosophy, which is basically pop in, get the care that you need in a quick and convenient way.
That's wonderful. How do you feel that, what do you think sets Popcare apart from other urgent care facilities or clinics?
I think we realize patients have choice. There are other urgent care facilities, there are emergency departments, there are primary care doctors. Patients do have choice. We feel like we provide a unique situation in which we really focus on having a comfortable environment. We understand being in a healthcare facility can be stressful. The medical condition that brings you in is stressful anyway, and we wanted there to be a comfortable environment. We are experts at providing quick service. This is what we do for a living. We multitask very well, and so we're very conscious of the patient's time. We do get them in and out very quickly. And what we've done in our facility that's unique is get all the services they need in one spot. You can come in if you need an imaging study, like an x-ray, that gets done on the spot. If you need to have medications, most of the medications you'll be able to leave our facility with without needing a prescription. We have lab testing on site. So a visit that normally would take a couple days to get all the tests done and all the studies, we can get done on the spot in 30 minutes, sometimes even less.
How do you know the difference of when to go to an ER and when to go to Popcare?
That's a great question. Basically, we do have a website that's popcareplus.com where you can go online and you can see a comprehensive list of the different symptoms and problems that we usually treat. At an urgent care, you can always call us and we can help decide that for you. Or you can come in, and if your symptoms do not make, we are not able to take care of, we would certainly transfer you out to an emergency room.
Can you give a few examples of some of the conditions or problems that you might treat at Popcare?
Absolutely. We see a whole gamut of problems. We see from runny noses to severe infections. You know, we see a lot of cuts and lacerations. We are able to do different procedures. Because we are emergency room trained, we've seen a whole spectrum. And we're generally able to diagnose and treat on site.
It's wonderful.
In the website, which you mentioned, it's Popcare Plus, so you've got the plus sign afterward, but when you refer to it, you just call it Popcare. What's the plus mean, or why is that in addition?
We do provide a number of other services other than just urgent and emergent care. We have Department of Transportation testing, school physicals, employment physicals. So the plus is to remind us sometimes that we do things other than just urgent care.
Okay.
And we also wanted to borrow a little bit from the classic Swiss Red Cross that everybody understands is healthcare related. But to kind of stay true to our concept, we wanted to reduce the anxiety level that patients have when they come, and we switched the red to a green. Everything that we did as far as what Popcare is about is try to reduce the anxiety levels that already exist in patients that come in and see us.
What about insurance? Do you accept insurance, or how do people expect to pay for it?
We accept all forms of insurance. On our website also, you can find a list of insurances that are in-network, considered in-network. We bill at an urgent care level, not an emergency room visit. And if you are an uninsured patient, we do provide a self-pay option at a very affordable rate.
Mm-hmm. What kind of hours do you guys have?
We are open Monday through Friday, 9 a.m. to 9 p.m., and we're open on weekends from 9 a.m. to 5 p.m.
That's
great.
wonderful.
Yeah.
I remember after I had my third baby, I had ended up being mastitis, and my doctor, my doctor had to send me to an emergency room, and I waited for over 8 hours. After just having a newborn baby to be seen. And so I think this is wonderful that you offer this option for sort of that, I don't want to say middle of the road, but somewhere between primary care and emergency room. So thank you both so much for joining us. We're going to give the information for Popcare. And again, be sure to check their website for a list of different problems and that they treat there. So Popcare Plus Immediate Care Clinic is located on South 27th Street. It's south of College. It's in Franklin. The phone number for more information is 414-877-5445. And you can go to Popcare Plus, and plus is spelled out. So popcareplus.com. Great to meet you both.
Great to meet
Thank
you.
you.
Thank
Thanks
you
for
so
having
much.
us.
Absolutely.